name's Katy Mouse. I'm a nursing student in the Family Nurse Practitioner program at Henderson State University. And today I'm going to be demonstrating a simple interrupted suturing technique. So I'm starting with, I have washed my hands, done hand hygiene, I have a sterile field and sterile gloves on, and all of my materials. So I have lidocaine or lidocaine with epi, depending on where on the body you're suturing. I have needle holders here. I have scissors to cut my ears with my sutures, and I have my forceps. So today I'm using a silk suture. Silk is a non-absorbable suture, and it has it's a multi-filament. It's good for handling. It's good to use. It's good to, it doesn't slip. It is good to knot. However, the monofilament sutures are better because in different ways they have increased or decreased risk for infection. They're better cosmetically. So that's sort of where we're starting with the suture. So I have already irrigated my wound as well. So for a small wound like this, probably 100 to 200 milliliters of like a sterile saline with some moderate pressure to clean out any debris or rocks or grapple or whatever may be in there, so we don't suture those in there with this. So I'll start by numbing the area up. And I will just go kind of all up and down. My banana doesn't like to absorb my lidocaine, but this is how we're gonna do it anyway. So once all of this lidocaine is in, I will test the area and make sure that there's no pain. Pressure is acceptable. That's what we expect to feel, but we don't want any pain. So where I start is by grabbing my suture with my needle holder, about 2/3 of the way up, and just pulling it all out. So I'm gonna start, I go perpendicular. With my forceps, I'm gonna grab the edge of the skin, and the important thing with these is to not crush the skin. It's easy to do that with these because you can get kind of heavy on your hands. I don't have skin hooks today, but they do cause less of a risk for skin crushing, so that's good. But those are another alternative to use to hold the skin here. So I'm gonna go perpendicular here, and the key maneuver here is to go through the epidermis and the dermis, and to keep a hold of the edge of the skin with the forceps as you're pulling the needle all the way through. Then you can release and re-grab your needle and banana. Grab the other side of your skin. Make sure you get the epidermis and the dermis. See if I can get this good. This banana is not really working with me well. Oh, there you go. All the way through. Make sure you're not twisted. And this is where you will tie off your knot. And you kind of want to make like almost a rectangle into the skin and into the dermis. So I will start with going over. And another kind of key feature here, key maneuver, is to not force the skin together. So approximate. I'm gonna go under. I'm just gonna make a knot here. With the silk, you usually don't have to make as many knots because it's easier to knot. So with the monofilament, sometimes you have to do 4, 5, even maybe 6 knots, and to make sure it stays and doesn't come undone over the next few days when the wound is healing. So there's my knots. I'm going to pull to one side. I'm going to grab my scissors. I'm going to leave a few millimeters, 4 to 5 millimeters of what we call ears, and I didn't get this one, so that this is easier to remove whenever they come back for this removal. So I'm gonna do one more suture. And I wish my banana would suture a little bit better. I'll try to be better here. Perpendicular. And don't release the skin here on the edge. Don't crush it either. We're gonna go through the other side. Okay. Make our knot here. See if I can get this thing to approximate. All right. Got all our ears here. So another thing to do is, like, kind of a key maneuver is creating that right angle, making sure it's perpendicular, and then when removal happens, you need to make sure whenever they come back for removal that it looks like it's healed, and you're going to clean the area to make sure that you don't get any debris that's left over on the skin whenever you're taking it. You're going to taking those sutures out. You're going to grasp one ear, and I'm going to grasp with actually the forceps here. One ear, and we want to go as close to the skin edge as possible with our scissors, and then pull the suture out with the forceps. And depending on, and these forceps are not grabbing these for me, but depending on where the sutures are will depend on when you need to take them out. If this was on a face, 3 to 4 days, and you can take it out. Scalp would be about 5 days. Arms, legs, things like that, a little bit longer, like 7 to 10 days. Feet can be even longer, 10 to 14 days. So that is our simple interrupted suture technique. Thank you.